The science and technology is there today to help any advanced cancer patient understand what's driving their disease. If you have a doctor that's not supportive of helping you understand that, find another doctor. Genomic sequencing is a way to personalize a diagnosis and also a treatment strategy. Whether you have breast cancer, prostate cancer, lung cancer, disease is not a one-size-fits-all. It's unique, and the answers are in the DNA. My name is Bryce Olson, and I'm the global strategist for Intel's Health and Life Sciences Group. When people hear me talk, they think that I must be some PhD, and I'm not. I'm just a regular guy whose back was against the wall. You know, I had to figure this out, or otherwise I was gonna die. I've been battling metastatic advanced cancer for almost 5 years, yet right now today, I have no evidence of active disease. I feel morally obligated to be able to share with people what I did and help them do the same thing that I did. When I got diagnosed, I went through that one-size-fits-all, everybody gets the same treatment paradigm, and it didn't work. So I kind of started to lose hope. But then I learned about genomics through the work that Intel was doing. I called up my pathologist and I just had 2 words for him. I said, sequence me. So when you sequence my normal tissue and look at the normal DNA building blocks of my blood, and then you compare that to the DNA of my tumor, there's some differences. And those differences are what are driving the cancer. The insights that you get out of genomic sequencing are threefold. First is there an FDA-approved drug for my unique driver of disease for my cancer type? The second is there an FDA-approved drug for a different cancer type, but that I share the same genetic drivers for? The third is, are there clinical trials and new drugs that are being developed that are a great fit for what's driving my disease? Those are the 3 different treatment options that become available to you, and that is all new doors that are above and beyond the standard of care. So Intel's technology underpins the entire genomics-guided precision medicine workflow. We went from a period where it took 10 years and almost $3 billion to sequence the first genome to something today that can be done in a day for $1,000. Really, I mean, today it's for advanced cancer patients, but I think in the future, the moment you get diagnosed with cancer, you'll get genomic sequencing. Today, we're living in this world where we are awash with data. We need companies like Intel that can sift through all this data and find patterns that maybe the human eye doesn't see. And in the case of healthcare, these patterns and new insights can be life-saving. Technologies like artificial intelligence are speeding that up and making it much more efficient and faster and accurate. But the only way they're going to be able to figure it out is if we give more data to the machines to find patterns that don't exist when you look at small amounts of data. The more patients that get genomic sequencing enables more data to be out there for researchers so they can start to create new drugs that would go after mutations that we don't even know how to stop today. People always ask me, so where should I go get my DNA sequenced? If you're going to an academic cancer center, they all have the ability to do this for you. If you're going to a community hospital, all they have to do is send the specimen, which is your sample, your tumor sample, to a place like Foundation Medicine, and in 2 to 4 weeks, you get back the results. We all deserve to feel new hope. Sequence Me is a call to action. I want every advanced cancer patient out there to go into their doctor's office and say 2 words, sequence me. Demand genomic sequencing, because genomic sequencing can open up new doors to fight cancer.